Welcome back. ICU capacity levels across the state have triggered more stay-at-home restrictions as hospitals are seeing a surge in patients, and the state is now desperate to make sure there's enough room. According to the California Department of Public Health, more than 59,000 California healthcare workers have been infected with COVID-19. 228 have died. Now the department is notifying hospitals that they can suspend their nurse-to-patient ratio, allowing for more patients for every nurse. But that's leading to protests tonight. KION anchor Veronica Macias joins us live. And Veronica, a large group of local nurses believe this can lead to more burnout and then more serious health issues.
Yeah, burnout from the sheer number of patients and the rituals that they've had to do with cleaning and disinfecting. But they say, despite those ICU numbers, Aaron, it's very simple. They say the more patients that a doctor or a nurse gets, the less care that a patient receives. And they also say it puts them more at risk here.
From day one of this pandemic, everyone in the country has known that winter was coming, that a monster surge was going to slam us at the start of flu season.
On Wednesday morning, the California Nurses Association held a virtual news conference protesting the suspension of California's nurse-to-patient ratios. With the latest coronavirus wave inundating hospitals with patients, it's been all hands on deck, and nurses believe it's dangerous to stretch them thin.
That's at the heart of patient safety. So we want to make sure that our patients are kept safe.
Studies have shown since the enactment of this law that the ratios save lives. So when you start to break ratios and you start to loosen them up and you expand, you start adding one patient, the chance of a fatality goes up 7%.
That alarming number is being widely cited by the California Association today, though they say it doesn't take a study to understand that with more patients a doctor or a nurse has, the less care each patient receives. Central Coast hospitals have not broken the ratios, yet already 180 hospitals in the state of California have, according to the state's website. Nurses being asked to sign waivers. Nurses protesting in solidarity and making sure hospitals in the Central Coast aren't added to that list.
It's the planning that's key. And so if they haven't taken care of the planning, then maybe they need to come back to the nurses and figure out, okay, how do we make this happen safely?
Hospitals in the area like Natividad say that they continue to meet ratios, and Salinas Valley Memorial Hospital issuing this statement agreeing to the issue of patient care. It's important for all employees to understand that SVMH does not intend to request a waiver to change our nurse-to-patient ratios. Instead, we continue providing patient care as we always have, meeting or exceeding nurse-patient ratios in the interest of patient safety. It's all about a nurse's safety and mental health, they say. Far too many have been infected. Adding patients adds more exposure. For that reason, nurses and staff at hospitals today were using their breaks to protest in solidarity.
It's literally our most important safeguard in the hospital.
Nurse Ferris also telling us today that she thinks those other options are bringing in resources from other areas, bringing in retired nurses, and also training more nurses. Aaron?